They come in pill bottles or from the streets. Drugs. And last year, they killed more than 100,000 people who overdosed. Thing is, that number keeps going up. In San Antonio, outreach groups are helping state researchers learn more about those cases and how many people are surviving overdoses. The Night Team's Patty Santos shows us how one group is trying to save lives.
In my area, I saw 6 overdoses in 2 weeks.
Some of the most vulnerable in the community, trust activist Susana Segura.
One of the things that my family does is we feed people on the west side of San Antonio, and we've been doing that for over 20 years now.
Segura is a perfect example of who can help addiction researchers find out how many people in the community are using drugs to the point of overdosing, something that's not well documented.
It can open the eyes for people that maybe aren't aware that a problem exists.
She joins other community leaders who are being trained to help share that information. The new Texas Connecting Overdose Prevention Database, or TexCOPE, was created by researchers at the University of Texas at Austin.
These are the people who are, the most impassioned about the populations that, our research is on.
Corazon Ministries, 210 Street Reach, Bear Area Harm Reduction Coalition are just some of the organizations in our community that will be using the database.
A lot of the data that they have is 6 months old. We don't have real-time data for overdose. And so a lot of our efforts to improve the overdose crisis, it's really just kind of throwing spaghetti at a wall.
Lead researcher Casey Claiborne says data collected by volunteer organizations can help agencies know where to deploy outreach efforts more effectively.
50 to 70% of non-fatal overdoses go unreported in Texas.
The database will be used by a select group, asking 5 specific OD questions about the event, like where did it happen, what kind of drug was used, and was Narcan available. Researchers can then look at trends captured by that data and be more specific when they request funding to prevent more deaths.
Our project is based in prevention, so we fall along the spectrum of helping find a solution to the epidemic that we find ourselves in.
Claiborne says this work is also personal.
I'm tired of friends dying from overdose, and we need to make a change. And the best way to make a change is to do something completely different.
Patty Santos, KSAT 12 News.
Bexar County, El Paso, and Austin launched the pilot program for this database last year. And since then, TexCOPE has identified groups to partner with in our county and Bexar County. And the program launches statewide this fall.